I recently had a patient that had suffered from a significant amount of abuse, physical abuse and sexual abuse when she was younger. And those experiences, I believe, led to her anxiety, depression, and some PTSD symptoms. And it was just, it really made me think how um, some people during their childhood, how they are so vulnerable and some can be taken advantage of, which can lead to a significant amount of mental health problems when they're adults. This particular patient had anxiety, major depression, and a significant amount of PTSD. So I think in listening to her story, it just made me have a lot of empathy for her because she was powerless during that time. Nothing that happened to her was her fault, but she has to deal with the aftermath of what it has done to her and her mental health. So I feel like as a psychiatric nurse practitioner, especially in these some circumstances, it's important to have a lot of empathy for these patients because they had no way of helping themselves. They had no way of really preventing that trauma from happening to them. And I think I had a great appreciation for her trying to get the help that she needs in order for her to heal and to move past all of that trauma and to also deal with the consequences, the mental health consequences and impact that it had on her. I think from her story, I think I learned a lot about how I feel like probably children that go through trauma specifically need a lot of therapy. And I think that there's a huge deficit in children that suffer from any event, from anywhere from trauma to losing a parent to any of those. And that don't get the therapy that they need, which leads them to be dysfunctional as adults. So I think it really made me think about possibly going into children and adolescents because I feel like if corrections can be made during their childhood years, I feel like anyone that goes through a traumatic experience in their childhood years, if they see a psychiatric or get psychiatric care during their childhood years, they have, I feel like, a bigger chance of recovering and becoming functional members of society and not having those significant mental health problems in their adulthood.